Good afternoon. This truly is Doc Talk Live. I'll bring you in a little bit closer, Rodney. There we are. So let me just fix this a little bit.
Hello.
So I was talking to Rodney Overstreet.
Yeah.
Is a CRNA, a certified registered nurse anesthetist.
Yeah.
So basically, you put people to sleep for a living.
Yeah, literally.
And as opposed to, I'm going to talk a little to you about anesthesia, but I've noticed that you've gotten into hypnosis.
Yeah. I recently became certified in hypnosis. I had an opportunity to go on a mission trip that I had gone on the year before, and it was canceled because of violence and instability in the area. So when it was canceled, I went looking for something else I could do to enrich myself and humanity in general. And I've been interested in hypnosis for about 20 years. There was a course, and it was taught by a man I respect, so I went and did it.
So explain to us what hypnosis is. And for me, I want you to sort of contrast it with anesthesia.
Yeah,
because
sure.
in anesthesia, what you're really in many ways doing is trying to sort of put the brain to sleep.
Yeah, absolutely.
So that they can do surgery, or in my case, various procedures. You're trying to put the brain to sleep. But I want you to talk about hypnosis almost in compare and contrast with anesthesia.
Absolutely. So what I do normally on a daily basis is I take medicines and I deliver those medicines into the patient's bloodstream, and then I administer a volatile inhaled anesthetic, a gas, and that keeps the patient asleep. And we want the patient not to remember anything. We don't want them feeling anything. We don't want them moving sometimes. And so we do that with chemicals that are sort of like a sledgehammer. We're forcing the patient asleep in that respect. Hypnosis is much different. Hypnosis is shrouded in mysticism, and there's lots of misinformation out there regarding hypnotism. But everybody hypnotizes themselves every night. When you go to sleep, you pass through a alpha and a theta state of brainwave activity that is characteristic of the hypnotic state. When you read a good book and you get lost in that book and you realize that time's passed and you didn't know it, that's hypnotism. When you're driving somewhere and you don't remember how you got there, but you just remember you just arrived, that's hypnotism. So everyone can be hypnotized, but only about 90 to 95% of the population can be hypnotized with a hypnotist or a hypnotherapist because of trust issues and some things like that.
Okay, let's break this down a little bit slower.
Yeah.
So hypnosis is like a trance.
It is a trance state, that's correct.
And it's characterized by certain brainwave activity.
Yes, you can diagnose it on an EEG, an electroencephalogram.
Whereas when you do anesthesia, you're sort of taking a sledgehammer,
A chemical sledgehammer.
forcing the brain into a trance-like state.
Yeah, we're dampening it down with drugs.
And is the brainwave activity similar to hypnosis, or is it different brainwave activity?
Yeah, so with chemical hypnosis, our agents are actually hypnotizing agents. They deliver the hypnosis ultra rapidly, very quickly. So this whole situation occurs very slowly. In the old days, when we used ether and other medicines that were slower on, you'd actually have a state where it was called the excitement phase or excitement stage, because hypnosis would occur slowly as the chemical hypnosis. But now our medicines are very fast, and you pass through it. Just like when you go to sleep at night, you pass through that trance state pretty quickly. You go from being aware, saying your prayers, meditating, thinking, to that little middle state where you're not quite asleep, but you're not quite awake.
So in anesthesia, you do hit that state.
You do?
But you're in it so quickly. Now, as an anesthetist, could you, if you wanted, keep somebody in that state with chemicals?
Yeah, so I actually utilize the hypnotic state of anesthesia to help patients. So a patient that wants to quit smoking, or a patient that has chronic pain, fibromyalgia, or chronic pelvic pain, or migraines, sometimes when they're waking up from anesthesia, I will give hypnotic suggestions if the patient wants that. So I will whisper to them as they're waking up, that you're doing great, you're safe. When you wake up, you're going to be headache-free, or you're not going to want a cigarette, or you're going to help them lose weight or whatever, because those hypnotic suggestions that you deliver as they're percolating up from unconsciousness back through those trance layers, those hypnotic suggestions will take.
Okay, so let's back up a little bit on that, this hypnotic state. With hypnosis, you're dealing with I suppose, the unconscious or subconscious. And please talk to me. Tell me what consciousness, subconsciousness, unconsciousness.
Yeah.
Maybe
Yeah, it's a good
define
three.
those terms to start with.
So you can think of you, who you are, the Rodney, is the frontal lobe, your prefrontal cortex, this little grapefruit-shaped part of your brain, the very front that separates us from all the other animals. That's kind of who you are. And in hypnosis, what we're doing is we're moving, if you will, that aspect of you out of the way so that we can have access to your subconscious. And your subconscious is sort of like a computer. It's cold storage. It's the hard drive of your computer. It's not thinking. It's not feeling. It just stores loops, and it stores data. It stores information. It's automatic retrieval. And so you'll hear...
what about when you're dreaming? Is that your subconscious when you're asleep and dreaming?
Yeah, so the subconscious... the conscious mind is trying to make sense of what you collected during the day, because short-term memory is transferred to long-term memory during REM sleep. So during REM sleep is when we're retrieving data that occurred during that day or around this 24-hour period, and we're trying to fit it into the hard drive. But when we're doing hypnosis, what we're doing is we're allowing our critical faculty, our conscious thinking mind, and we're moving it out of the way so that the hypnotherapist or the hypnotist can access the hard drive of the mind and help break unhealthy loops. Or if there's been a big psychological trauma, we're going to take those hooks out of the mind. We're going to release the person from that trauma, help them release it from the trauma, or release from the pain.
So the trauma is in the
Subconscious mind, yeah.
the subconscious mind.
Yeah.
And the hard drive is the subconscious
That's
mind.
correct, yeah.
And the conscious mind is the what drive?
That's the active you. That is the me, the ego.
Okay. So in hypnosis, you're trying to change the hard drive.
Yeah. So what you're trying to do is you're trying to untangle negative thoughts or negative patterns or looped patterns or traumatic anchors that have occurred in your past that are associated with behavior that's not desired by the client.
Now, why do you think you can do that through hypnosis? What is it about hypnosis? Now, I hear what you're saying, which is it's through hypnosis that you access this part of the brain.
Mm-hmm.
It's hard to access when your frontal lobe is, let's say, in play.
Yeah. And
so I get the hypnosis aspect, but what I don't get necessarily is the tinkering component of it.
So as long as you have this critical faculty, this filter, if you will, this conscious filter, you can't. It blocks the work from occurring in the hard drive. You can't play with the hard drive. You can't help reprogram or deprogram as long as the person has this filter in place. And this filter is our consciousness. Your consciousness right now is blocking you from accessing this hardwired part of your mind. And by going into hypnosis, we turn off the critical faculty, the filter. We move the filter out of the way so that the therapist or the hypnotist can allow the client to do the work into the hard drive.
And how does that work then? So I see, once again, I see how you get into the hard drive.
Yeah.
By moving the filter out of the way, but I don't necessarily know how
it's all client dependent. Each situation is going to be so unique. But let's say we had someone who had chronic pain. So one of the first things that we would do is we would induce a level of hypnosis into this individual, and we would regress them back to the first time they experienced this pain, and we would have them examine the situation that occurred, examine the emotions that they felt whenever that situation occurred, because we know that you're a pain expert, and there's two types of pain. There's neuropathic and what's the other pain?
I'm going to say, nociceptive.
Yeah.
I was going to say somatic pain.
Yeah.
Okay.
And we know when a tissue gets injured, it hurts, but then the tissue heals, and it shouldn't hurt anymore.
That's right.
Right. And if there's let's say there's a pinched nerve, and that nerve's going to keep hurting. But there's
yes.
lots of types of pain that occur where there's no real reason for the pain to be happening.
There's no structural reason anymore for the pain to be happening.
Yeah, but nothing's cut, nothing's burnt, nothing's crushed.
But the experience of pain is still there.
Yes, and it's
That's
real.
Right.
The
and
pain
it's real.
is real.
It is in your head.
Yeah.
But it's in your head.
Right. Pain isn't pain until it reaches the brain, and the brain is what interprets the pain. And so we can do lots of things through hypnosis to help the person, the client, decrease their pain or resolve their pain.
How? That's what I want you to get. Tell me how we do this.
So this critical faculty, this me that's speaking to the camera and speaking to you right now, I have a cone of intention and attention. And when I have my cone of attention on a certain thing, then it magnifies that thing, like looking through binoculars. And if I'm constantly looking through binoculars at my pain, because I do have a bad back, so from time to time my back hurts, and when I really start thinking about it and concentrating it, and when I wake up first thing in the morning and I check to see if it's hurting, that's me shining my cone of attention onto that pain. And if I'm constantly shining my cone of attention on that pain, then I notice it more and I magnify it. So I might, even let's say it was a 4 or 5 or 3, by looking at it and obsessing over it and always checking on it, constantly checking on it, I can push it to a 6 or 7 or 8. Then if I'm having a bad day and I'm stressed out, then that can also amplify it. So our emotions amplify and de-amplify.
But how is hypnosis changing your cone of attention? Why can't you just consciously, think of pink elephants? So how do you do that with hypnosis? How does hypnosis take the magnifying glass off the problem?
So we're taking the conscious thinking individual, we're moving that filter over, we're accessing the subconscious mind, and we're giving suggestions to turn that pain down. We will use metaphors. Metaphors like, if I'm talking to a person who's an electrical person, I'll talk about rheostats and dials. If I'm talking to a person who does photography, I might talk about aperture or lighting conditions. And so we use metaphors to help shift focus away from that stimulus that's always there, or we think is always there. And then we also examine the event and see if there was a big traumatic emotional event that occurred during that. And we also look at things called secondary gains, which are things that you get from a situation occurring. And let's say when the situation occurs, if you get a horrible headache, and you don't have to go to that family reunion you didn't want to go to that one time, and that was a positive thing because you don't like family reunions because your aunts get on your nerves or you just don't like your family. And then every time your spouse wants you to go to the theater and you don't like the theater, oh, that headache's coming on. Or wants to go to trade days at Tanner Hill and you just don't want to mess with people, you get that headache. And you don't even know why you get the headache, but it provided something for you, right? There's always a payoff, a reason. And by going into the hypnotic trance, it allows a lot of clarity sometimes because all the noise of our filter that's preventing us from seeing things, there's a certain clarity whenever we are able to observe the hard drive.
So one more compare and contrast. How does hypnotherapy, let's say, differ in terms of the way it works relative to psychotherapy?
Yeah, well, number one, I'm not a therapist. I'm a hypnotist, and so I don't provide any sort of therapy. There are licensed professionals who go to school for a long time to do therapy, and so
but I know, disclaimer.
Yeah, sure.
But I'm just trying to understand how a hypnotist. I get you now in terms of the hypnotist is removing the conscious
thinking,
getting to the hard drive. What's a psychotherapist doing, if you might not be able to answer that question?
I've studied and read a lot about Sigmund Freud and other thinkers, and they're doing a lot of the same things that the hypnotists do, and which are doing a lot of the same things that the counselors do. So there's a lot of, if you drew a Venn diagram, there would be lots of overlap between all these different fields, and we all learn from each other. There's NLP practitioners, there's Reiki therapists, there's acupuncturists. Anytime that you perform these rituals, even when you go in to speak to a patient, by you wearing what you're wearing and the way you present yourself, that ritualistic behavior puts your patient in sort of a trance mode. They immediately see you as an authority figure who's there to care for them. they develop a bond with you, a trust with you. So they're automatically going to be more receptive to the situation. So that is actually a hypnotic situation.
And finally, I'm just so my listeners and other folks will be listening at other times. It looks like somebody has put in a link to articles, which is good.
Oh yeah, thank you so much. There's tons of stuff on PubMed about hypnosis if you're interested. It's not a voodoo science. It's actually a hard science, and there's lots of good.
You mentioned chronic pain. You mentioned fibromyalgia. I think maybe smoking cessation.
Smoking cessation, obesity, pelvic pain, tics.
So those are the common conditions.
I mean, yeah, there's a massive amount of irritable bowel syndrome. Irritable bowel syndrome is very responsive.
Why'd you tap on my leg?
Because that's a good one. I mean, that's a good medical condition that we were always at a loss to treat.
No, fortunately, I don't have
No.
irritable bowel syndrome. But no, that's true.
He doesn't, I don't know.
So if you want to get a hold of Rodney, type into Doc Talk Live, and somehow we'll link up Rodney to it so he can do this. Rodney, I know that I appreciate you taking the time.
My pleasure.
I always love talking to you because you always expand my brain, and that's why I wanted to do this, and I'd love to do this again.
Yeah, I would too.
And keep the conversation active.
Yeah.
Thanks so much, Rodney.
Before I go, can I just offer you one thing?
Yeah.
So one of the things that we're always trying to do is move the body from the parasympathetic, the sympathetic to the parasympathetic. So there's two ways that you can be in life. You can either be fight or flight, which our society is really good at making us always feel like we're fighting or flying because of our jobs, stresses with kids, traffic, trying to pay the bills, and so we're constantly in a frantic kind of mode. And what we try to do is move you to this parasympathetic, which is the rest and digest. After your big turkey meal on Thanksgiving, where you're just kind of laying there, calm and relaxed. It's something that you can do at home, and you can teach your family, and you can teach your kids. Is to take the abdominal breath. So there's just an abdominal breath where your abdomen goes out as you breathe in. So you put your hands on your abdomen, and when you breathe in, your belly goes out like Homer Simpson. So big deep breath. You hold it, and you breathe out for 6. 1, 2, 3, 4, 5, 6. And what we're doing by doing the abdominal breath is we're hacking our vagus nerve. Your vagus nerve provides 80% of the feedback for your parasympathetic nervous system, the rest and digest nervous system. And when you take an abdominal breath, 3 seconds in, 1, 2, 3, hold, blow out for 6, 2, 3, 4, 5, 6. The abdominal breath will access the pharmacy of your brain. Every drug that we take from our physicians of the pharmacy, our body makes a form of that. So doing the abdominal breath, you release serotonin-like chemicals in your brain, serotonin, like Lexapro or those other drugs for anti-anxiety. You increase melatonin, which is the sleep chemical. You induce oxytocin release, which is the love hormone that you get from hugging or cuddling. And you also increase your endorphins. Your endorphins are your body's natural painkillers, the runner's high that you've heard of. So you can do all of those things by taking an abdominal breath. So every hour, every 2 hours, concentrate on taking 3 of those abdominal breaths, hands on your belly goes out as you breathe in. Hold it, and then breathe out twice as long. And if you want to read about the abdominal breath or the vagal breath, it's all over the internet. There's lots of really good articles on it. But that's the one gift that you can give yourself every single day, every hour of the day, that will help move you from a sympathetic fight or flight to a parasympathetic rest and digest, calm, comfortable, peaceful, and centered life that you deserve.
That is awesome. See, the show is over, and then the real show started.
Yeah.
That was the real show. If we could take this somehow and start the end at the beginning and move the beginning to the end, which would be perfect. All right, that's it. If there's any questions, let's see if there's any questions. I don't know if I can take these questions. Thanks, gentlemen. The sympathetic versus parasympathetic approach.
Live parasympathetically.
Live parasympathetically. Next time we do a show, I will go into my spiel on the autonomic nervous system and try to explain that in a little bit more depth. But I appreciate you doing this.
Thank you so much. Thanks for having me.
Okay, I'm going to finish.